Dr. Fauci, it's great to see you again.
Yeah.
I remember a few years ago when you were at the Hill's Future of Health Summit, and I said, tell me your up-at-night issue. What's the thing that really worries you? And I'll tell the audience, as in Business Insider, he described COVID to a T. How did you know it was coming?
Well, it's inevitable if you look at history that there have always been pandemics, even before we had the ability to adequately historically describe it. We have been through pandemics, some transforming, like 1918, some that had an impact but weren't globally disruptive, like 1968 and 1957. We had a mild one in 2009. So to think that we were not going to have yet again another pandemic, the only issue is how bad it was going to be. And unfortunately, one of the things you asked me, what is your worst nightmare? And I said, a worst nightmare is a combination of a virus that transmits very readily and has the capability of a high degree of morbidity and mortality. And unfortunately for the world, that's what we are living through. We're living through an historic experience, the likes of which we have not seen in well over 100 years.
Well, look, we have some real serious stuff to get into here, but I've got to address yesterday's news. And I don't know if there's a little Mark Twainism, where Mark Twain said rumors of my death have been way overblown. Rumors of your retirement, are they true?
I don't know where the word retirement came in. It was kind of a little bit...
Not mine.
No, I was the reporter...
You're not going to retire, are you?
No, I'm not going to retire. I may step down from my current position at some time, and one of the reporters had asked me, and the question originated was, if Donald Trump is the next president, would you still work for him in your capacity? And I said a very innocent but true thing. I said, whether it's Donald Trump or it's Joe Biden's second term, I don't intend to be in my current position in January of 2025. What happens between now and then, I have not decided. But the one thing I do know is that I have other things that I want to do in a professional way, that I want to have the capability while I still have the energy and the passion to do them. So I don't want to go beyond January 2025. When I step down from this position, I have not decided that yet.
So for the Twitterati, that's a denial of yesterday's reporting. I just want folks to know. Okay, so let's talk about the state of American health right now, particularly with regard to COVID. I think we're at about 67% vaccination rate and boosters and whatnot. I know from conversations with you in the past that that's not good enough. Is America its own petri dish for future variants?
America is part of the petri dish for variants because I don't think you can separate the United States from the global issue. Because as we've known painfully so, with Delta coming from India and BA.5 coming from South Africa and Omicron coming from South Africa, that we're all a connected world. So by allowing the virus to continue to propagate, be it here in the United States or in any other country, you give the virus the opportunity to mutate. And when you give it the opportunity to mutate, some of those mutations may lead to a variant. Now, a variant may not be relevant except if it has one or both of the following characteristics: that it's more transmissible than the prior variant, which is exactly what we're seeing with BA.5, as it is now pushing off the map in the United States, BA.2 and then BA.2.12.1, which is that it's sort of like a ladder of increasing transmission capability. Fortunately for us, the vaccines that we have available have been able to hold relatively strong, at least over a period of several months, to prevent you from progressing to severe disease leading to hospitalization and death. And that's not an opinion of mine, that's data. If you look at unvaccinated versus vaccinated with a one boost versus vaccinated with a second boost, the differences between hospitalization and death among vaccinated versus unvaccinated is without a doubt stunning and obvious. You don't need a statistician to tell you. You just look at the curves and they're there. So getting to your point, having 67% of the population in a rich, developed country like the United States is unacceptable. We have got to do better than that. And of those 67%, only about half of them have received a first dose, a first boost, which again is unacceptable. When you have the
So that takes us down to effective, effective vaccination at 35%.
Yeah, the confusion, Steve, and it's an understandable confusion, is that when you have a very transmissible virus, the ability to prevent infection and transmission is much less robust than the ability of that vaccine to prevent severe disease. So what we're seeing is increasing cases. There's about 130,000, 40,000 a day. That's an egregious undercount, because all of us know people who get infected, have mild symptoms, get a positive antigen test, and never report it to anybody. So it is very likely that the actual number is much more than 130 and 40,000. Number two, there's no doubt that the hospitalizations are going up, and that's purely quantitative, even if the virus is not inherently more pathogenic than the prior variant. When you get more people infected, if the proportion of infected people still stays the same, your hospitalizations are going to go up. And that's what we're seeing. And that's the real unfortunate, and I say tragic part of that, is that we have the wherewithal to stop that, at least to contain the serious nature. What we do need, looking forward, are better vaccines that have a greater durability, so that you don't have to say X number of months later, your immunity wanes. Even if the strain doesn't change, your immunity wanes. And secondly, we desperately need a vaccine to prevent acquisition and transmission. And one of the ways to do that...
We need a new vaccine.
Oh, absolutely. We need the next generation of vaccines, particularly mucosally administered vaccines, that would do much better.
Who's likely to have it?
What do you mean, who's likely to?
Who's likely to produce that vaccine?
We are, if we have the resources.
Yeah.
We have an incredible amount of talent in this country. If you look at just what we did with the mRNA, the immunogen design, the stuff that came out of the NIAID,
so are you
the stuff
saying
that came
you're
out of
not
industry.
getting the resources you need for that next vaccine?
No. I mean, look what happened. We asked for a certain amount. Originally, we wanted 22 plus billion. It got cut down to 15. And then the international part got cut out with the 5, and we're left with an amount that, first of all, we want to make it clear that we are very, very grateful to the Congress for being as generous as they have been.
But you'd like to be more grateful.
Well, not like, it's essential that we get more resources, or we are not going to meet the challenge that's inevitable. What I don't want, Steve, speaking about retirement, which I'm not going to do, I don't want to have an interview with you 3 years from now when we have yet again another challenge and we say, do you remember back in July of 2022?
I know we're going to have an interview 3 years from now on something else, and it raises this question about both the science and the political ecosystem in your experience. You've done Zika, Ebola, N1H1, HIV, AIDS, and of course, COVID-19 and its various forms. I guess, are we learning from episode to episode to episode, or are we getting worse?
From a scientific standpoint, we're learning. Clearly, if you look at what's happened with the vaccines, that never in our wildest dreams 5 years ago would you have thought, from the time a virus was identified to the time you had hundreds of millions of doses going into the arms of individuals, it would be 11 months. Historically, when people start writing the history of this, there'll be the scientific history and there'll be the public health history. And unfortunately, the public health history has been severely marred by the political divisiveness in this country, where you have the decisions upon parts of the country to whether or not to use a highly effective vaccine, to whether not use drugs that clearly don't work, are actually decided on ideological lines. I mean, forget, you know, Steve, I am not a political person. I have no political affiliations. But if ever there was no place for ideological determination of public health principles, it's when you're in the middle of a deadly pandemic. So that's the reason why you hear me all the time, and very people say it on the far right, criticize me for that. We're not trying to take your liberty away. We're trying to tell you to do what's prudent to save your life.
So what would help you? You heard me ask Richard Besser a moment ago what we basically needed to do by way of investment in public health infrastructure, and were we derelict? And he basically said yes, even in this moment.
Right.
And I'm just interested, with you as the quarterback of a team of scientists focusing on this deadly pandemic. It's had terrible, terrible impacts on the world and the United States. What do you need to succeed that is not in place now?
Well, Richard said it from a public health standpoint. As you know, even though I am, and I am very proud and privileged to be the chief medical advisor to the president, that there are two pillars of the approach. There's the scientific approach, which my entire professional career, up to 40 years as the director of NIAID, that I've been responsible for, is preparing us scientifically. Then there's the public health preparedness. And as Richard said, very appropriately, we have let that get a level of attrition which is dangerous, where you really are not in the 21st century of being able to do the kind of communication, surveillance, the kinds of things that you need. So what we've got to do is keep up and continue to support the scientific basis which allowed us to have a transforming vaccine. At the same time, you dramatically increase and support our capability for global public health interaction, transparency, communication, all the kinds of things that you need to do. And we are lacking in that. We have let that attrit for a very considerable period of time.
I know that you were not going to tell me what your private conversations with President Biden are, but I'm interested in the outlines of whether you generally go to him and say, Mr. President, we need you out there asking Congress for that money. That if we do not get that money, we're not going to develop the next generation of vaccines, and this country is going to be hurting badly.
Well, I think if you just look at what's happened, it answers your question, Steve. Yes, I and many of my colleagues on the team have encouraged the president to do that, and the president has come through and actually done that. I mean, just listen to what the president says. He keeps saying over and over again, we do need the Congress to come through with support if we're going to do what we want to do. So we don't have to convince this president to do that. He's already doing it.
Let me ask you finally, there's an organization I came to know through you. Richard Hatchett heads the Coalition for Epidemic Preparedness Innovations.
Right, CEPI.
And CEPI is designed to be a kind of global platform, funding some things, helping to kind of raise awareness, building an international fast response mechanism to not only this pandemic, but future ones. Does CEPI have what it needs? I'm fascinated by the fact that our health is a function of another person's health that may be very remote from this country.
Right.
And how we make better investments in that infra. We're fighting over resources in the United States. What resources do we need to be fighting over globally? We have Atul Gawande coming up and asking him the same question. So maybe you can give me some foreshadowing to what he's going to say.
Well, Atul's organization, USAID, is suffering like we are from pulling away that $5 billion for the international, which he needs and USAID needs. I don't want to speak for Atul. You'll hear from him shortly. But with regard to CEPI, we have formed very recently, it was just announced a week or so ago, a coalition with CEPI to do just that, pandemic preparedness, with a partnership between ourselves and CEPI, which is great because partnerships help because they leverage each other.
Well, I'm going to have to leave it there. Can I just say it's such a privilege for us to talk with someone who has, without embellishing at all, saved millions and millions of lives. Thank you so much, Dr. Anthony Fauci. Not about to retire, just want to put that on the record. But Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Disease, thank you so much. Let's do an MBS, but come.